Okay, guys, so now we're going to go through the capstone Canvas course. So, lots of ways that you can navigate this. You can do the modules, and it effectively will show you the assignments that exist within the class itself. So, just to show you what you'll see on your side. You have your orientation assignments, your journal assignments, preceptor evaluation of student progress, and your midterm and your final evaluations, and then your professionalism points will also be in there, which we discussed during the syllabus and then the handbook. So that's one way to get to the things that you need to. Also through assignments, you can see everything there. But the other thing that you will be able to do and navigate is through this homepage are quick links that will take you directly to the assignments themselves. So hopefully you're watching this as you go through the capstone orientation. But just to kind of go back and show you what that looks like, you can navigate through the tabs off to the side. Please take your time going through this. Make sure that you understand everything. If you have questions, reach out to your instructors. We want to make sure that you guys are really successful moving through the capstone experience. You get a lot out of it. You have support from us. And then to do that, you can do your book-in for a check-in appointment, or if you just need to chat with your instructor. So by clicking this, there's two videos that show you how to do this. Please make note, there's different ways to set up an appointment with, depending on who your instructor is. The reason behind that is because some instructors are in their own Canvas, have only one section, and then Robert and I have multiple sections. So if you're working with Camille, if your assigned instructor is Camille or Laura, and as a reminder, Laura has section 2 and Camille has section 3, then you're going to be booking your appointment with them through the Canvas calendar. Just like you have for previous courses, like the clinical judgment for your ISPEs or for lab pass-offs, you'll just go in and book an appointment. Here's a live link to the Canvas calendar. It should take you right there so you can book one of those time slots. Just make sure you have your section selected and so it'll pull up what appointments are available. If you're assigned Robert or myself, you will be in either section 1, 4, or 5. And because we're over 3 sections, we can't really use the Canvas calendar to schedule appointments so that you all will have access to them. So we're trying to utilize a new platform called the booking page through Microsoft, which you guys will have access through with your Bruin email. This video walks you through. It's really simple. It's very, very much like the Capstone Canvas page, but you just look for the dates and then off to the right will pull up the times that were available and you can click it and book it that way. You can also add your preceptor's email in there too, and then they should be able to get a meeting invite that'll have the Zoom link. So we're gonna try it. We'll see how it goes. If you guys can give us feedback on that, that would be great. But watch the video, and then this link will take you directly to that booking page. So that's how you'll do it. If you do, if you go to schedule an appointment, and this is just a pinned, I have a pinned announcement just on the home page here. What I need to complete a check-in, but there are no appointments. What do I do? There's a chance, there's a likelihood that you're gonna go into the Canvas calendar or you're gonna go into our booking and you're gonna look for an appointment on the day that you want and the that you would like and that your preceptor is available and it just isn't there. It doesn't mean it can't exist. It's just that when we make those appointments, we try to hit the masses with when we're gonna be the most available to you guys. But we're more than happy to work with you to try to schedule one-offs or to make arrangements to make sure that you guys can navigate through. We just need time to do that, right? So if you please look to schedule in advance, and if you go to look and there's no appointment at that time, just reach out to us right away. Whoever your assigned instructor is, reach out to them first. What we typically will do, all of us instructors are really in great communication with each other. So even if your assigned instructor might not be available, it doesn't mean somebody else can't step in and help facilitate an appointment check-in for you guys. So just keep that in mind. Communicate. Wow, that was a tongue twister I just gave myself. But we can't help you if we don't know that you need help, right? So please don't just blow by your check-ins that are outlined in the handbook. Make sure you stay on target with all of those for the timing on when they need to happen, and reach out to your instructor if you're having difficulty getting those appointments booked so that we can keep you on track. Again, we're just here to support you, help you make sure you have a smooth transition through this course. So other things that you're going to find here: Capstone instructor contact information, the handbook, and other resources, just another way to get to it. And we'll go through these different assignments. The midterm and the final evaluation assignment, it's a placeholder. You don't have to turn anything in here unless your instructor gives you other instructor instructions. We do this through Exact. So when you get to that Exact tab in the orientation module, it walks you through that. It's a really simple process. You just log into Exact, go to your learning assessments or evaluations, can't remember off the top of my head, and it'll be right there for you to review and sign. And then that's it. So please don't feel like you have to turn anything into those. There are occasions where Exact is not very friendly to us, so we may ask you to submit it through Canvas, or if there are other circumstances that may lead us to needing to utilize that Canvas assignment as a placeholder, but you don't have to use that by and large unless you are told by your capstone instructor. Okay. Now, the capstone instructor contact information, effectively, this can be found in your syllabus, but this is all of the instructors who are working in this course. We have, our email, our phone numbers. Again, we prefer texting our phone numbers first, only because we all get spammed phones. So we don't answer them all the time. I mean, if you leave a message, we'll call you back, but texting is usually the fastest. You're also going to notice that on each of these links, there's the Zoom link that we use to facilitate the capstone meetings. We do our best to make sure that it's also in the appointment that you guys booked. But if for some reason you can't find it, go to the capstone or not preceptor, capstone instructor contact page, and then you just copy and paste that link into a browser and it'll take you there. That's also the link that you'll need to get to your preceptor for the midterm evaluations, because that's who we want to be meeting with and see how you're doing and progressing. So looking then at the capstone handbook and resources, again, it's just the PDF, or there's even an online link. We do sometimes suggest, depending on how your capstone is going, whether you like the facility and the unit or not, sometimes we will suggest to do an informational interview with the manager, the hiring manager. That's where you'll find this Word document, just gives you some information. And then if you have an injury, please notify your instructor as soon as possible. Even if you're a nurse apprentice or anything, again, the whole point of an incident report when it comes to an injury at Capstone, we just want to make sure that you guys are getting the care that you need, depending on what happened with the circumstances, right? So, like a back injury would be different treatment strategies than a needle stick, for example. And we just want to make sure that we get you connected with the right resources, but the sooner the better. Those are circumstances where, like, you're blowing up my phone until I answer and can get back to you if you have questions about what to do next. And that's totally okay. The next assignment, or we'll just start looking at the main assignments of this course now. You have a few orientation assignments, so you'll have the orientation module quiz that you'll take after you're done going through the whole orientation module. You have your syllabus assignment and the handbook acknowledgement assignment. And then you'll have your timesheet assignment that will exist in there, which is effectively just want to keep track of where you're at. We talked about that in the syllabus, and in the handbook a little bit, but you'll find that assignment in your capstone orientation unless you go through the modules. And then you're also going to have your unit orientation assignment. Everybody has to do this. It has to be done with your first 4-hour orientation shift. Even if you're in an RNA, and I know what we talked about the differences between RNA and the capstone and how you're tracking your hours. Everybody still has to get 100 regardless of the type of placement that they have, but that can be found in that orientation button or within the modules. So the journal reflection assignments, if you click in here, again, it's just another way to get to the assignment, but this really outlines the importance and how it connects back to our course objectives and why it's really important. Information about submitting, we need at least 6 hours, please, so that we can review them. When we meet with you guys for your check-ins, we really want to be very intentional with our time and how you're doing and giving feedback on and advice on how you can just get every little ounce of experience out of this capstone experience, helping you transition into professional practice. So down below are all the potentials. Most of you guys will only need 8 journal entry assignments, but depending on how long your shifts are, you will have potentially more assignments. See this as this if needed. And we spoke about the breakdown of the points in the syllabus, so we won't dive into that again. But just so you can see what the journal itself looks like. Now, the assignment looks overwhelming. This is not the assignment. Really, the only piece of the assignment is 1 and 2, where you have to type them, and we will not accept a handwritten or a tablet written journal entry. But the meat and potatoes of the assignment here is 2 paragraphs, a reflection on your shift. So for your journal entries, guys, we want it to be more than just a task of what you accomplished. Like, I don't want it to say, I got report, and then I went and did my assessments, and then we gave medications, and then we went back and did more assessments, and we got a new admit, and then we did a discharge, and then we went home. Like, that's not what I would like to see in your journal entries. I would really like you guys to explore, reflect on your experience and what did you see and what did you observe and how did you feel about it? Or how did you see other people on the unit react? And would you do something different if you were placed in that situation? Or do you think it was handled really well? Um, as far as tasks go, if it's a new thing, like if this is the first time that you put in a Foley catheter successfully or started an IV, like yes, we want to hear about those successes and celebrate with you. Just it's one more step and towards that transition into professional practice. But if it's something that's this routine thing, and you've done it multiple times, please don't continue listing it out. Now, if you get stuck, that's what 3 is for. 3 are all prompted suggestions below. So if you're like, well, I don't even know what to talk about for shift 3 because that was 13 hours that I don't exactly know what I did. Use these prompts to kind of try to help dissect the shift a little bit and process it and understand it and think about, okay, this is what we did today. How am I going to use that information to inform my practices for shift 4 and for shift 5 and for shift 6? Again, Capstone's all about growth, growing into that independent practice as a nurse. Just having the benefit of having a preceptor support you and with those patient experiences and on the unit. So you're gonna to fulfill this assignment, you'll need to download this Word document, and you'll notice it's the line it's only one box, so that's so that you can type in it, and the boxes will just expand for however much room you need. So use the prompts if you would like to help guide your reflection, 2 paragraphs per shift. And then we're gonna have you treat this as a running journal. So what I mean by that is every shift you add, you're just gonna save the updated version of it and turn that into the next journal assignment that's due. So, example, let's say you're working on, or you've just attended shift number 3. When you go to turn in journal entry number 3, it will include journal entry number 1 and 2 and 3, all on that same submission. just a running journal, so to speak. So that is the journal. The other assignment that you guys have every shift are the preceptor evaluation of student progress. And again, this just talks about like what it's for, how it connects to our course objectives, how we would like you to use this as a learning tool. This really should be done. It needs to be done before you leave your clinical site at the end of your shift. Okay. This is collaborative between you and your preceptor. This is not just you do it independently and then hand it to them for them to hurry up and sign, put things in there and sign it, and then you guys are out the door. It really should be used to help you identify like what are you doing well? Because the things that you want to keep doing well, you want to leverage those to help strengthen areas that you maybe need a little bit of improvement in. So let's say you're not doing super well in time management quite yet, but you're really great with your critical thinking, right? So how can you use that information to increase your effectiveness with your time management? Your preceptors and your instructors have great insight to that. I mean, we've been nurses, most of us are still in some sort of practice area in one way or another. You have your preceptors who are there with you, who've also learned that transition. So we can give you some tips and feedback on how to just continue to create this forward progression towards independence. Okay. You also will have to have them sign off on the clock in and clock out time. And then make sure that you have when that 30-minute break was given. And then this just makes sure you know that we're keeping track of those hours, we're verifying them, that you have all 100s, that you don't have to worry about um, anything of not getting those 100 hours. We just want to make sure everything is very, very well documented, especially for accreditation purposes as well. So what that assignment looks like, you'll just click on whichever one you're getting ready to turn in. And honestly, I suggest you just print a few of these out. However many shifts you're going to need to do, print them out, put them in a folder, take them with you to your capstone. That way you don't have to worry about not having one. It's challenging for preceptors and for you guys to have to like think backwards if you forgot to bring them. So I would just print them out and bring them with. Up top, you just have the demographic information, really. Preceptor is here so that not everybody will have the same preceptor throughout their capstone experience, and that's okay. We talked about that a little bit earlier and what that might look like. Just make sure it's legible, their name, so we can have a name that ties down to the signature below. And then you guys are going to notice how this scaling works. So up top is the scale that your preceptors will use, 1 through 6. And you'll notice it's just observation to working independently. So how independent are you in these areas? So for your first few shifts, we wholly anticipate and expect really that you're going to be in the 1s and 2s where you need your observation, you're requiring moderate assistance, which basically means your preceptor is really walking you through everything. Now, by the time you get to your midterm, we really would like to see you start moving from 1s and 2s into the 3s and 4s. If by halfway through you're not starting to they can monitor you but they don't you need a little bit but not a whole lot of assistance, minimal. That's where we would like you to start moving towards by your midterm. If you are still in the 1s and 2s by your midterm, then we'll talk about strategies, what's going on, how can we improve, what might needs to change in order to help you move out of those 1s and 2s into these higher categories. And then hopefully by the end of your capstone, you're in 4s, 5s, and 6s, depending on the category itself. Like, for example, if you're in an ICU and you get to the end of your capstone and you're only at a level 4 or level 3 with competence with equipment because your patients have been on dialysis and a ventilator the whole time, I don't expect you to become an independent practitioner in the ICU in 8 shifts. That's not a realistic expectation, right? What we do want to see, though, in these numbers very high right out the gate are these two categories right here. Positive attitude, punctuality, and professionalism. Um, this pains me to say, but I have seen on these before zeros in scores in these two categories. Our scale doesn't even start at zero. So if we see a low number scale in these two areas, then we'll talk with you. We'll have to have a conversation, see what's going on, and make a plan for improvement in these areas. Okay. Down below, you're going to have a goal for a shift. So talk to your instructor about this and also your preceptor. We really want you to move towards independence in your practice, right? That's the whole purpose of capstone experiences, culmination of everything you've learned in nursing school, and you're applying it to patient care with a preceptor kind of showing you the ropes at your side. So for goals, and I know this is something that you guys do in your oh my gosh, sorry, your transitions class, where it's like, what do you hope to achieve by the end of your capstone experience? Do you want to be able to do a head-to-toe assessment independently by yourself with minimal corrections suggested by your preceptor? I think most of you guys would blow that goal out of the water, right? All of you would, actually, because you should be darn near close to proficient with head to toes. And then other examples, though, might look like if you're on a med surg unit, managing the care of 1 to 2 patients, mostly independent by the time you're done with your capstone experience. You guys can get there. I think this is a really great time to realize you guys know what you're doing. And you're just putting those pieces together when it comes to routine care at the bedside, while still being critically challenged by new things that are coming up and really putting all of the things that you've learned over the course of nursing school into patient care. So to help form that goal, then this is where you're going to do a little reflection. What do you think you're doing well? What do you want to work on? So kind of thinking back to the journal assignments, leveraging your strengths and using those strengths to help improve areas where you would like to improve. And then your preceptor is the blue box. Okay, so what are they doing? What are you doing well? What do they think you're doing well? And then what areas do they think you need to improve on? This is just constructive feedback, guys. Everybody should be totally open and welcome to constructive feedback on where you can improve. We always have room to just get a little bit better each time. And that right here can really help inform your next shift goal. So maybe they say for where you can improve on, maybe it's confidence with delegating, right? So then your next shift, that's what you're going to practice. And it's just so that you can help find those areas that are ones that you could improve upon to just be a more well-rounded, effective nurse. Okay. Here's where you're going to do your clock in and clock out time, and then they'll sign, please. Now, if there's any concerns your preceptor has, I just want to be very transparent with you guys. We've given them a way that they can give feedback to us as course leads. So if there's anything regarding concerns about safety or attendance, unprofessional conduct, uniform noncompliance, this is a QR code that they have with their preceptor handbook that they should have received by accepting you as a student. It's in their handbook as well, but it's also here on the evaluations. And then their contact information is there, or my contact information, I guess I should say, is there as well. For this assignment, remember, 1 per shift, and then you'll just turn those in the same schedule that you will for your journals. For these assignments, guys, like I said, the preceptor evaluation of student progress, okay, and then your journal assignments. Those are really the 2 assignments that you are going to turn in throughout the semester for this course. And really, it's not even the semester. It depends on when you finish your capstone experience. It goes along with how you complete your hours. They shouldn't take a lot of your time. Please don't let them take up a lot of your time. Your preceptor evaluation of student progress assignments, those should be done before you leave for the day. Make a plan with your preceptor. Give them an opportunity to fill this out and then build in time with them to go through what this means, what the values mean, where they think you can improve, coming up with a goal for your previous shift. I think a great suggestion is to offer to go grab the last set of vital signs before the shift is done so that they have time to just sit and like focus on that, and then you guys can work on getting feedback. The journals, once the shift is finished, is when you are going to complete that journal. Please don't take more than 15 minutes to write it. If you're taking more than 15 minutes, and it shouldn't really even hopefully take you that long, you're spending too much time on that assignment. Okay, these assignments are not made to take up time. They're just made to help you reflect, process, come up with a plan for continuous improvement, and then to move on to the next shift until you finish out those 100 hours. Okay. So that really is the bulk of how to navigate through the capstone course. If you have any issues with that or any concerns, again, please reach out to your instructor following this capstone appointment check-in, or you can message us in Canvas. That's what we're here for. We're here to support you. And then we will be moving into the how to submit stuff through Exact after this.